All right, Janine, thank you very much. Janine Lee, Mthatha in the Transkei, Kwiphondo leMpuma Koloni. Good morning, Molweni. Now, sexual wellness is a major part of our adult lives and can often make or break relationships. One of the biggest factors within this subject is erectile dysfunction. At least 1 in 10 men will experience this in their lives, but there are now many ways to address this. To talk more about this is renowned gynecologist Dr. John Miklos. He's an internationally recognized lecturer and author. Dr. Miklos, good morning to you. Welcome.
Good morning, and I appreciate
you very much.
Well, thank you for the opportunity to come speak to your audience.
No, thanks for coming to talk to us this morning. So first, sexual wellness. What does it mean and how can people achieve it?
Well, sexual wellness is the knowledge and education that one has to make sure that you're healthy sexually. And how you achieve it is primarily through knowledge and education. And then once you have that, you can treat the underlying problems that a person might have.
What are some of the problems that men and women have around sexual wellness?
Well, I think there's a big misconception, and the misconception is that it's a psychological problem when a man has erectile dysfunction, when 85% of the time, it's actually a medical problem. So if you can get the medical problem treated, and you remain healthy, then it allows for a stronger sexual prowess and increased relations with your significant other, your spouse.
And for women, what would be some of the problems that they experience?
Well, there's a whole myriad and slew of problems, and they can go anywhere from not having the desire to want to have sex, lacking estrogen, and having the appropriate body functions that they want to engage in intercourse, and sometimes just pelvic pain. It can really deter a woman. If you had pain every time, you don't want to have sex.
Can there be lifestyle changes that people implement that will help enhance their sexual wellness?
Well, one of the big problems, and most people aren't aware of this, is that smoking increases your rate of erectile dysfunction by 85%. So cessation of smoking, minimizing your alcohol intake, and a good healthy diet. The problem in the states where I'm from is that the men tend to eat a lot of fatty foods, and they're getting larger as time goes on. So that's not good for your sexual wellness.
You were talking about the low libido. What causes that as well?
Well, low libido, it's amazing, is that 5% of 20-year-olds have low libido. See, when a man hits about the age of 30, his primary hormone, testosterone, starts to descend. And as it goes down, so does our libido. So sometimes what we need to do is be replaced with hormones. So what's important for people is lifestyle change, watch out for smoking, look at your diet and your physical condition as well. Yes, and some of the problems that you can have, medical conditions, diabetes, high blood pressure, high cholesterol, very prevalent in my society where I'm from, and I'm assuming it's also prevalent here. If you can control those issues, it allows for better sexual wellness. Now, when men get a little older, then there's also the erectile dysfunction problem. And fortunately, in today's society, there's a lot of different ways of treating it.
Which includes what?
Number one is testosterone replacement. But we know that there's pharmaceutical industries out there now that produce medication. Now, a lot of people don't want to talk about it. The reason why it's so important is that if you are in a relationship with a woman and you want to maintain that sexual relationship, the problem is when you don't have a good sexual relationship, there's a lot of stress and anxiety and a lot of discord where you're angry with one another. So you can treat it also with some natural pharmaceutical agents that are now on the market today.
Side effects from using those kinds of agents? Well,
the true pharmaceutical agents, primarily headache, but the more natural ones out there, there's less of a chance of headache. You must be careful with the pharmaceutical agents on the market today that you're also not taking certain medications that are nitroglycerin, amyl nitrate medications, and some certain types of heart medications. The natural supplements, not so much anymore.
I just want to go back to the first point you were making, that sometimes erectile dysfunction is caused by medical problems.
Yes, diabetes, high blood pressure, and high cholesterol.
Okay, so if you address those, then you can address the outcome as well.
It can certainly help. But sexual wellness may also imply that you need more, not only the right nutrition, but also supplementation through natural ingredients.
Okay. All right. Thank you very much. Dr. John Miklos is a gynecologist joining us this morning. Thank you very much for coming in to talk to us this morning.
Thank you also.
Thank you very much. John Miklos joining us here on Morning Live this morning. Time now for the sports news.